Good evening. Amnesty International released a startling report today. The research shows many South African mothers are dying because they're not getting the right care while they are pregnant. Salil Shetty is the group's Secretary General and joins us on Newsnight. Good evening, Mr. Shetty, and thanks so much for coming in. We know that antenatal care in South Africa is free in the public health system, yet there's still this deadly cocktail of factors that is driving maternal mortality. Why is that?
It's quite tragic, actually, and I personally spent some time in Mpumalanga, which is on the Swaziland border, meeting the women who are experiencing this suffering. And it's very unfortunate because the entire sort of post-apartheid health system was meant to tackle inequality. But what we see on the ground is that if you're poor, you're a woman, if you're rural and you're HIV positive, the system struggles to deliver. So, we have a lot of women dying. The antenatal care is not reaching them. And the focus of our research really was to understand what were the causes behind this.
And that's what I'm really interested in. I mean, things like HIV, the stigma associated with HIV and people visiting these clinics, the lack of information are some of the factors that your report highlights. Just explain how those are preventing women from receiving the right care at the right time.
So first of all, we have to understand that this country tragically has we're in a situation where at least 1,500 women die every year from pregnancy and childbirth related problems, and 30 to 40% of the women who die are HIV positive. So when we talk to the women, essentially they focused on three main reasons as to what's blocking them from using antenatal care. The first is cost, because it takes a lot of money to reach, get the transport to go to these antenatal care centers. And it might not look like a large number for us, but if you're a poor female-headed household, it's a lot of money. And the second is the stigma, as you mentioned, because when you go to these clinics, the government is clear that testing is not mandatory, but in fact they're often tested. They're made to stand in separate lines, separate areas, so the discrimination. And finally, it's the lack of education. They don't know that they have a right to informed consent. They don't know the importance of antenatal care in the early weeks. So these are some of the main obstacles, really.
I'm very interested to find out, Mr. Shetty, whether some of these findings have been discussed, beforehand with the Minister of Health in South Africa, who's been credited with making a lot of strides and progress, particularly in the arena of, mother and child health care. I mean, he was, involved recently in the UN's Partnership for Maternal and Child Health Care. And part of the measures that government has put together is about things like access, talking about making these programs at the 3 feet level highly accessible. Are you saying that these programs are failing?
No, I think if you take the aggregate picture on fighting HIV/AIDS and in dealing with maternal health, there has been important progress. But South Africa is in a catch-up phase because initially we had a decade of denial on HIV/AIDS. So now there's a catch-up. There's still 6.5 million women or so who are living with HIV, 6.5 million people in this country, and 30% of the women who don't have antenatal care who are pregnant are HIV positive. So I think there's goodwill, but take the Millennium Development Goal on maternal mortality, for example. So this is one of the few countries in Africa where actually the maternal mortality rate has gone up over the last 10 to 15 years. So there's still a big challenge. I think the government's done a lot, but this is a problem which can be easily fixed.
And if you were speaking to our health minister, what would you be saying to Mr. Shetty?
So yeah, I think you asked me also whether we've talked to them already, and that's absolutely Amnesty International's methodology. It's primary research, and we always show the findings to the health ministry, and I think they were in agreement. But the problem we have is that so many ministries are involved here. They need to talk to each other: the education, the transport, the health ministry. And so our message is clear. We're meeting with the deputy president tomorrow as well, and our message, we got 3 clear messages. First, that the Article 19 of the Constitution guarantees the right to privacy. They have to enforce that. You can't have these health centers exposing these people's HIV status. Second is we absolutely need reliable, safe, affordable transport, which means subsidized or free transport. And third, you need sexuality education. There's no shortcut to this. Women need to know their rights. They need to know the importance of these things. And I must just say one last point, which is that you might wonder, why is Amnesty International even concerned about these issues? Because you might traditionally associate us with issues
human rights abuses, but it is a human rights abuse.
Exactly, it is, unfortunately, because this is guaranteed by the Constitution, and also it's guaranteed by so many international treaties and conventions that the government of South Africa signed up to.
Well, we'll be certainly interested in seeing what the feedback of your engagement with these different government departments will be. We appreciate your time. Salil Shetty talking to us about that report on maternal death, speaking on behalf of Amnesty International.